burden of sickle cell disease is on the rise, especially the western region, where 18% of children born are having sickle cell trait, and 4% of the children born in Western Kenya have sickle cell disease. This is in our backyard. It is not far from us. As Kisii County, our positivity is also high. The children that we've been screening through Afya Dhabiti Sickle Cell Foundation, Federation of Kenya, and the Hemophilia Foundation, the support they've given us, we are getting to have 14% positivity on traits, sickle cell traits, and 4% positivity on sickle cell disease. This is a worrying trend which we don't need to bury our heads but start discussing.
The partnership we have with the Novo Nordisk Hemophilia Foundation, together with us and the county government of Kisii and other counties, to train the health workers to learn more how to manage the disease. But again, we are working closely with the community health promoters to sensitize wale watu mashinani wajue kama mtoto ako na ugonjwa selemundo anafaa kufanya nini.
Early detection is key, and to me, coming to this institution, Kisii Polytechnic, is a statement to say that young people now need to come out and make that decision and know their status.
We have to discuss either as elders, women, church leaders. The same way you tell young ones to get tested for HIV before they go and get married, let's also have that discussion. Let them be screened before they get married, so that we will know if you have a trait or not, so that we can reduce the cases.
We are emphasizing, let every child be tested, let them be screened, and then they go to the hospital, they'll get the help. When they get to the hospital, we also have support groups. We're also advocating for medication, because it's, you heard, it's a lifelong disease. The drugs are very expensive for most of our parents. We are grateful for the government who included sickle cell disease in the SHA. We are encouraging parents to also register for SHA.
If we keep on keeping quiet, the numbers will rise. The next time we'll be celebrating, we'll be talking about 20%, 10%. Is that good? That's a question that as leaders we need to ask ourselves. Let's not shy away. And if there's a child who has sickle cell disease, we can manage the condition here in Kisii County.
Now seeing a worrying rise in cases here in Kisii County. Recent data from Kisii Teaching and Referral Hospital shows that approximately 295 patients are currently attending the sickle cell disease clinic at the facility.
Burden also increases because of the financial responsibilities like transport, food, accommodation. When you go to MTRH,
we have trained the health workers. We want to talk to the community. We just wanted to say that yes, sickle cell disease is a high burden disease for many parents. Let people know their status so that you make informed decision when you want to start a family, or even if you want to look for a lifeline partner. That is the only way we can prevent the disease, by early detection, diagnosis, and then we see how to manage the disease. That is the message we have for people.
Samuel Isaji, clinician representative Western Region. Sickle cell and hemophilia, they're like twins. So when we are like establishing a clinic for hemophilia, we also think of having a clinic alongside for sickle cell. So in hemophilia in the whole country, currently we have estimated 950 patients, and in Western Kenya there are around 350. Here in Kisii we have an average of 20 patients, but we are working very hard so that we identify more patients, because in the whole of Kenya we are supposed to have like 5,000 male patients who are affected with hemophilia, and you see we have that gap. Up to now we have only identified up to 950. So we are working hard with the county governments, the hospitals, all the institutions, even the families, the community, so that they assist us in getting these patients. So any patient who is complaining of maybe excessive bleeding after circumcision, after dental extraction, or after surgery, they bleed a lot, we encourage that those patients, they come to be tested. We have a machine here in Kisii, semi-automated machine, the testing will be done. And in terms of treatment, we give factor. If factor is not available, they can still get blood products, that is FFP and cryo. And we are not leaving aside the women bleeders. Of course, we can concentrate on male, then we forget the female. So we are encouraging any female who have problem, maybe after menstrual they bleed a lot, or after delivery they bleed a lot, or after any surgery or nose bleeding, we encourage them to come for testing. So testing is done here in Kisii, but in case they want further testing again, it can also be found in MCRH and